done. Thank you. Thank you very much. I appreciate it, Whip. I want to thank Reverend Warnock for bringing us together here today. He is a true leader, and he makes his leadership count. And now he is here to lead us, to lead our Congress, to lead our country, to save lives. I also want to thank his partner in this effort, Senator Ossoff, who also demonstrates these qualities of leadership for the people, and Senator Baldwin, who is determined to be on the front lines to make change. I welcome our friends from the House. So glad that you are here, Whip. It is an honor that you would be with us to lift up this issue. And Representative Bordeaux, I am grateful to you for all that you do every day because it is right. In America, access to a doctor or a hospital should not depend on where you live. Getting cancer treatments or insulin to manage diabetes should not depend on where you live. Avoiding bankruptcy over bills from a broken leg or a child with leukemia should not depend on where you live. And yet, here in America, the richest country in the history of the world, care that is routinely available in 38 states is out of reach for millions of people solely because they live in one of the other 12 states. People who are caught in the Medicaid gap because their states stubbornly refuse the help offered by Obamacare don't get access to health care that millions of other Americans get. The Medicaid coverage gap has left low-income Americans, including those in rural communities and Black and brown communities, in the lurch. They make too much to qualify for traditional Medicaid and yet too little to afford private insurance. And make no mistake about the racial injustice that this gap inflicts on America. More than 60% of the people in the coverage gap are Black, Latino, or AAPI. Healthcare is a basic human right, and it is shameful that millions of Americans still lack access to health care because of where they live. But here's good news. We can make change. Reverend Warnock is leading us to a new time, a time when all Americans get access to affordable health care. He has shown us the way to permanently close the Medicaid coverage gap. And better yet, he is leading us to make these changes now. Healthcare inequality is a matter of misery and pain, and for some, it is a matter of life and death. Healthcare inequality is also about what is morally right, and denying access to affordable healthcare is a moral disgrace. I am honored to stand alongside Senator Warnock to introduce the Medicaid Saves Lives Act, a bill that would stand up a federal Medicaid program for people who are caught in the coverage gap. It is time to give people the coverage they have long been promised and to close the Medicaid coverage gap for good. And I am honored to be here with my colleagues to get that done, and particularly honored to be here with another great leader from the state of Georgia, and that is Representative Bordeaux.